So hello friends, now in this video we are going to start with another topic of the antimicrobials, that is cephalosporin. Okay, and we will complete the whole of the antimicrobials in upcoming days. Okay, so first we will discuss about general spectrum, and we know that in cephalosporin we have 4 to 5 generation of drug. Okay, and we are looking for the spectrum of each of the generation of the cephalosporins. Okay, so for gram positive, first generation has the highest activity. Okay, and then it is decreasing to third, and for gram negative the order is reversed, the highest is for third and the lowest is for first. So these are the first for the first 3 generation, and for fourth and 5th generation both are equal for gram positive and gram negative. Okay, so fourth and 5th generation is equally active against both gram positive and gram negative, whereas first, second and third is having variability in action against gram positive and gram negative. Okay, now the next important point that you have to note down is that all cephalosporins are bactericidal in nature. Very important point. It is generally asked that which of the following drug is bactericidal, which is following drug is bacteriostatic. So mind it, all cephalosporins are bactericidal in nature. And what is the mechanism of action of the cephalosporin? Okay, so mechanism of action is just inhibition of bacterial cell wall synthesis. Okay, so mechanism of action is inhibition of bacterial cell wall synthesis. Now first, coming to the first generation. So first generation is usually used for streptococci, staphylococcus aureus, some proteus, E. coli and klebsiella. So this group of organisms are mainly targeted by first generation drug. Now it includes, so you can use mnemonics, that is Dr. Lolo in Ju, Dr. Lolo in Ju. So doctor for this. Okay, so cephadroxil, the first is your cephadroxil, the second is for cephalexin. Okay, the third is for cephaloridin. Okay, so in for in and low for yellow. So the first is your cephadroxil, then cephalexin. Okay, cephadroxil, cephalexin, then cephaloridin, and then U for cephalozolin. Okay, so remember this, very tough to memorize. So cephadroxil, cephalexin, then cephaloridin and cephalozolin. Okay, now these two drugs, that is cephadroxil and your cephalexin, these are oral drugs, whereas this cephazolin is your parenteral drug. Now coming to the cephazolin first. So cephazolin is very important. It is drug of choice for surgical prophylaxis. So surgical prophylaxis drug of choice, that is cephazolin, which is given through parenteral route. Now it is excreted by glomerular filtration and 85% bound to the plasma protein. So 85% plasma protein binding capacity is seen with the cephazolin. Now the next is your cephalexin. So cephalexin is less active against your penicillinase producing staphylococci. It is not metabolized and only excreted in urine unchanged. Okay, and it is used as oral therapy. Okay, and we give 0.5 gram. Okay, 2 times daily. Now, and oral therapy is effective for inhibition of many gram positive and gram negative bacteria. Now coming to the cephadroxil and cephaloridin. So these are oral agents similar to cephalexin. Okay, properties are similar to cephalexin. Clear? Now moving to the second generation cephalosporin. So second generation cephalosporin includes a wide range of drugs. Okay, and that can be memorized by a mnemonic, simple mnemonics, that is Phalo, okay, Mayur, Taxipar. Okay, so Fa for cefaclor, then Lo for Lorascarbate, Ma for cefamendol, then cefuroxime, then cefotitan, then cefoxitin and cefprozil. So difficult to memorize, okay, but you can use this trick. Okay, and these group of drugs are mainly used for E. coli, klebsiella, proteus, Haemophilus influenzae, Moraxella, Catarrhalis. Okay, and these are not as active against gram positive in compared to first generation. Okay, as we have seen the spectrum of those all the generations drug. Now coming to cefuroxime. So it is good activity. It had good activity against Haemophilus influenzae, meningitis and pneumonia. Activity against E. coli, Klebsiella is modest, and it lacked activity against B. fragilis. Okay. Now cefuroxime acetyl. So it is ester of cefuroxime, 30 to 50% absorption through oral route and hydrolyzed to cefuroxime in plasma. Now then cefprozil, cefaclor and loracarbate, it is orally administered drugs. Now cefotitan, it is the most active against anaerobes. So this point you have to remember about the second generation drug.